A very warm good morning to everyone. My name is Tarannum Manjul and I am the assistant editor at ELITS. I would like to thank everyone for giving us your valuable time and accepting to be a part of the third Healthcare Transformation Summit organized by ELITS and powered by Gupshup with eHealth magazine as the knowledge partner. As digital technologies continue gaining adoption, they start enabling new ways of organizing how value is created. This transition means moving from value chains to digital ecosystems. This is giving way to new industry giants which rely on the strength of their digital ecosystems to attain market dominance. And this is the topic of our panel discussion now, creation of a digitized ecosystem. I would like to welcome our panelists for this session, Mr. Yasin M. Chaudhary, Mission Director, National Health Mission, Jammu and Kashmir. Welcome, sir.
Well,
Mr.
thank
Arvind,
you so much.
Mr. Arvind Sivaramakrishnan, Group CIO, Apollo Hospitals. Welcome, sir.
Namaste.
Mr. JP Dwivedi, Chief Information Officer, Rajiv Gandhi Cancer Institute and Research Center. Welcome, sir. Mr. Abdullah Salim, CIO, Omni Hospitals. Welcome, sir. Mr. Pradeep Bhaskaran, Head Information Technology, Bangalore Baptist Hospital. Welcome, sir.
Glad to
And
be
Mr.
here.
Mr. Devanand Keti, Regional Chief Executive Officer, Esther DM Healthcare, who will also be chairing this session. We are definitely looking forward to a very insightful discussion, and I now hand over the baton to Mr. Devanand. Thank you, sir.
Thank you, Taranam. Thank you. First of all, good morning, everyone. It's wonderful to be here. I think this is my third time I've been participating in the Let's conference, and I'm really excited to be among all of you for two reasons. One, basically the kind of panelists that we have in the panel. It's so their experiences so diverse. We have people representing the public as well as the private side of healthcare. So that is the most important, one of the important reasons that I'm feeling really excited to be moderating this panel. And second is the subject, digital healthcare ecosystem. That in itself is a very, very interesting topic. Everyone talks digital now. Even our country in the recent budgets have given that specific focus on the digital health as well as the digital mental health. So but even then, when we say digital, there is a lot of things to be done. There are opportunities, there are challenges, there are a lot of deterrents, and that's exactly what we will discuss today in our panel. And I'm sure our panelists will also give you some real life situations to connect with what they are doing in their organizations. So without much delay, I start the discussion by shooting the first question to Mr. Yasin Chowdhury, who is representing the public side of it. He is representing he is handling the National Health Mission in Jammu and Kashmir. So the first question is to him, and I just would like to get his opinion on what you consider, sir, as a digital healthcare ecosystem. What is it according to you? Because you are part of the government in implementing most of the strategies as devised by NHA. So we'd like to get your perspective on what you consider as a digital healthcare ecosystem.
Right. Thank you so much, Mr. Devanand, for the question. It's wonderful to be here. So, as MD NHM and also as CEO SHA and also as SNO of ABDM, my perspective for a digital health ecosystem in a country and from in a country like ours and from a perspective of a civil servant is a system which actually enables interoperability across various regions and healthcare providers. And secondly, it is a system which upholds the WHO's principles of UHC, universal health coverage, in terms of equity and equality. And it's a system which actually enables us to break the pre-existing barriers of access and quality, which ail our huge governmental system. So, to be more clear about it, it is an interoperable system that must be built for universality, compatibility, and durability. So, say a system like what ABDM is imagining itself to be must be a system which should work in the same manner from Kashmir to Kerala. It should be compatible with the HMIS of a leading hospital chain like Fortis or Medanta, but also for a small government-run subcenter in a remote village. And it should be durable. That is, it should be able to host and operate the data of our billion citizens. And most importantly, a system which must uphold two very essential concepts here: that of data privacy and data security, which I believe are an extension of our constitution ideals here. So, as a public servant, when I imagine what I have to build through ABDM or a digital health system at any level, small or big, these are the things that I think about.
Yeah, thank you so much. Thank you so much for your perspective. So that was from the public health perspective. So we will go to a person who's leading the IT function for one of the biggest the private health players in India. That's Apollo. So Mr. Arvind, I would like to shoot you the same question to get your version on the private healthcare. You're representing the private healthcare, being part of the biggest healthcare player in India. So, what, according to you, is the digital healthcare ecosystem in the private health perspective?
Uh, Honestly, Dev, it's no different from what Sri Yasin said. And this is ensuring that you have seamless access to information across all roles that service the entire healthcare delivery. And being private, obviously ensuring that we are doing this with financial excellence and clearly expectations around operational excellence, service excellence, and clinical outcomes that match to the best of the best in the world, with high levels of automated clinical practice guidelines, evidence based care practices, mixed with a very optimized and effective operational back office of the entire health delivery system. Information seamlessly flowing through and not limited to only those who are in the realm of hospitalization. So, as long as you're taking care of the whole aspect of health, illness to wellness and wellness back into continuing to stay well, managing conditions that don't necessarily need hospitalization, and doing it with a good sense of prudence on economics as well as outcomes and efficiency. I think bring that together, that's really the power of digital in healthcare delivery. And every member of the healthcare delivery fraternity, public or private, will look for it. Obviously, with private, there will be a little more thrust on certain aspects. But having said that, I'm not trying. I don't see a distinction between public and private on this aspect of it.
Thank you so much. Thank you so much. So we have covered a very vast area between both of you: interoperability, durability, the financial, the excellence on different aspects of healthcare, and also the convenience that it offers, and breaking the barriers. So a lot of points have been covered. So now we'll go to with the same question to Mr. Dwivedi, who's actually representing an area which is niche in India, which is oncology. So is there anything specific when you look at your area where digital healthcare ecosystem has any difference, Mr. Dwivedi? So can we get some insight from you?
Thank you, Devan. So after hearing from Yasin and Arvind, actually public and private, both domains are fully covered. Hardly anything left for me to cover. So I'll give a different layered model to really objectively define how this digital ecosystem look like. Very foundation layer is infrastructure layer, where you have robust laptops, desktops, mobiles, tablets, everything at the end point available that is working as per the need and fully connected with the network so that these are interoperably exchanging the information between one endpoint to other endpoint. Very basic foundation layer. The next layer is ERP layer, enterprise resource planning, where, as Arvind said, financial excellence. So your purchases, your asset management, your finance accounting, materials, everything is covered. And unless these foundation modules are solidly in place, You can hardly talk about building higher structures above that. Next comes hospital information system layer, where your patient experience, patient management, bed management, billing, inpatient, outpatient, wards, everything is covered. And then thereafter uh, the ecosystem around clinical. So that is your pharmacy, laboratory, diagnostics, radiology, etc. The next layer is EMR layer or EHR layer, electronic health record system, where the patient data is available, orders can be placed quickly, the history could be seen as a single longitudinal health record, etc., etc. And finally, on the top is digital layer, where we talk about Internet of Things, we talk about the mobility, M health, we talk about analytics, deep learning, machine learning, AI,
I think we lost him. I think,
uh,
yeah. Please go on.
am
Yeah,
I audible?
yeah, you're audible now. Yeah, please go on.
So not sure where it was left. Basically, defining this objectively in Maslow's hierarchy of needs model makes it a very quantifiable and measurable kind of universe.
Yeah, that is very interesting. Maslow's need-based hierarchy brought to the digital health. Yeah, that's really nice to hear, and a lot of interesting ideas. Now, this is the ecosystem that we want to create, and probably most of the institutions have reached a level where they are already in the implementation phase. Some have successfully implemented it also. So we will now go to from the idea perspective to the real implementation side. How organizations have really leveraged the use of digital healthcare ecosystem. So I will go to Mr. Salim, who is representing Omni Hospitals. So I just wanted to know from you, Mr. Salim, what are the digital health tools or the systems that you have already implemented in your organization, and what do you think the future will be for your organization in terms of digital health? So if you can just connect with some real examples, that will be really nice.
Thank you very much for asking the questions, and I would just refer the Mr. Yasin, Arvind, and JP sir, especially if you'll see that a decade ago and now there's a huge difference in terms of the digitization and adoption of the technology for the healthcare fraternity per se. Currently, what we have done at our organization at Omni Group of Hospital, I'll just elaborate a bit so that and why it was done, so that it will give the clarity, the importance of the health digital ecosystem. We have removed the application module which are working standalone and as a silo by integrating to consolidate the clinical and non-clinical data, including multiple applications and medical equipment, introducing the clinic in pocket, clinic in bag, equipment integration to the patients to continue the care of continuity and better patient engagement. This provides the clinical notifications to the patient and the GP to take the necessary clinical actions. And why it has been done it, because it is the digitization is the demand of patient and the healthcare providers. Healthcare providers means all the doctors, nurses, and paramedical staff. So, which enables the data integrity with EHR, EMR, multiple device accessibility, opportunity to treat more patients. Doctors can work with remote, less number of cancel appointment, data analysis for healthcare system, time management for both patient and HCPs, minimum time loss due to the traffic questions to the other difficulties, bridging the gap for rural health, reduction in health cost, reduction, of course, the clinical errors which happens knowingly, unknowingly, Uh, and then availability of many specialist doctors to get the treatment, better patient engagement and continuity of care. So based on this, and these applications have been integrated and deployed to ensure that it is interoperable, and it can be integrated with the standard or structured, non-structured clinical, non-clinical data. And for example, I give you that we have introduced the medical coding standard. All four types of medical coding standard we have put in place, that is your ICD, CPT, SNOMED, and NOIC. So if we are talking about the interoperability to exchanging the data between within the organization, beyond the organization, within the country, beyond the country, so that perspective also we have put in place and implemented. Over to you, Mr. Devanand.
Thank you, Mr. Salim. That's very interesting. Care continuum mixed with telehealth notifications and usage of telehealth is what I'm hearing from you. You know, in terms of the implementation that you have already done at Omni. So now I would like to ask the same question to Mr. Pradeep, who is also representing the Bangalore Baptist Hospital. So, you know, is there anything that specifically that you've done in digital health tool implementation? You know, any specific thing that you would like to highlight here, and what do you think your future plans are?
Yeah, thank you. So I'll start with our unique circumstances as a hospital. So we are a 50-year, in fact, we are celebrating our Jubilee year this year. We've entered the 50th year of our existence. So we have a very long track record. Am I audible? Hello?
Yes, we can hear
Very
you.
much.
Yeah, all right. So considering that, we also have a very good execution under our belt with respect to how long we've been embracing technology. You know, our current solution that we have in place has been around for about 15 years. And overall, we can look at about a 20-year track record of, digitizing our ecosystem here. We work very closely with CMC Vellore, and we follow their model. They are very much involved in our, operations and give us guidance every day. So we've decided to transform. So our journey is currently in a mode of transformation of what we've had to where we want to get to. And over the past 3 years, we've been looking at a strategy where we evolve first, in the sense we acquire more technologies that are not there yet, and then look at ways of replacing the ecosystem with more modern technologies where we look at the basics and then things of that nature. Then when we went and tried to seek uh, a technology footprint from the industry, and we evaluated a lot of different software as well as infrastructure and frameworks. We arrived at a conclusion, that in the marketplace, especially in the healthcare domain, looking at pure IT technology, there is a dearth in terms of embracing, the cutting edge position that some of our social computing technologies where we exist today in our world, looking at Google, Facebook, and things of that nature, and initiatives in that space. So we wanted to bring that in, and so we started from the ground up. As Mr. Dwivedi, asserted, it has to be, right from the infrastructure, networking, all the way going up to many layers, right up to the EHR. So one of our major initiatives has been in the EHR space, and we have had a track record of about 3 years now. But surprisingly, it took us very little time to actually deploy it. We barely took 3 months to get it up and running. Now, one of the reasons for that is the existence of a framework and infrastructure that was already in place. So our strategy to evolve first enabled us to embrace newer areas that we didn't have yet. And that's been a wonderful journey. We probably have one of the highest adoption rates to claim. More specifically, I can mention that Walter Kluwer's up to date, engaged with us, and then we decided to do something together. And according to Walter Kluwer's, um, we are one of the first hospitals in India to do a first advanced HL7 integration with respect to our EHR. We can also talk about what transformation we've brought about in terms of the infrastructure, where we've gone out and out and uniquely for our needs looked at how do we do cloud inside the hospital. And then we came up with a private cloud kind of a infrastructure replacement, which is already done. We have many VMs running now. We have many different modern storage technologies, like the rain configuration, where we have redundant independent nodes that actually spray our storage in such a way that it's not only secure but is also redundant, and it's also something that we can rebuild and recover. It's alive all the time. If one VM goes down, another one just mushrooms in another server, and that's where we are. We've already done that. What
Thank
do
you,
we do
thank you. So
next? Yeah,
just to come in here, so you also mentioning that cloud has bring in that data privacy and security. That's what I'm hearing from the points that you're mentioning. So EHR and keeping the data in cloud is something which you have already done. So we'll come back to
yeah,
you to probably get your little more perspective on this towards a later stage of the discussion. So
sure.
now we all seen that last 2 weeks when we look at the India's budget, when it was presented, there was a huge focus on the digital health. So the government is driving. It seems that our country is also looking at implementing the WHO's plan for 2025. The WHO has also devised a plan for 2025 where they have clearly earmarked the strategies for implementation of digital health. So I think our country also is in the same line of getting it implemented. So we have none other than Mr. Yasin, who's representing the government of India, who's the implementation officer actually in the district. And so I know that when any such systems get implemented, even a private healthcare system gets a lot of obstacles. So what do you think when the government says through NHA or the United Health Interface that's been proposed by the NHA? What do you think could be the real challenges in implementation of the systems in a big country like ours? So, Mr. Yasin, over to you.
Right, sure. Thank you so much, Mr. Devanand, for the question. So, obviously, I would be referencing my remarks in context with the ABDM and the proposed setup. But broadly, the challenges that I imagine that the setup would entail. But before I begin, I would like to repeat a remark which I made in my keynote address earlier. They say data is the new oil. Uh, I've coined an extension of that phrase, and I say health data is the new gold. Okay, so and trust me, because we have some of the biggest lobbies like the pharma lobby and the private hospital lobby, if I may call it, and it's been corporatized so much, and there's so many huge business interests involved that if we embark upon this ambitious process of collecting the data, health data of a billion citizens, we very well know how valuable it could be. So the first and foremost issue that arises is data security. If NHA is going to gather the health records of billion citizens, the system that we're building should be robust and durable enough to withstand hacking attacks from anti-national forces or even scrupulous private players and you name what. It should be built in a way that the data must not be duplicated in order to allow its transferability to for any commercial utilization. That level of protection against any sort of exploitation must be built into the system. Secondly, the same thing that we saw with Aadhaar, and that's why a brilliant man like R.S. Sharma sir has led the charge in NHA as well, is the issue of data privacy. Whether if we are going to record an individual's details as to how I mean, are we firstly obviously seeking individual consent or not? And if you've been a part of the sandbox meetings of NHA, you would know that this is the fundamental thing that they are working upon, that no data collection would happen without the individual's consent, and that consent also in a digitized supply in a digitized chain would ensure it will be a matter of it should be recorded in the most seamless and most smooth manner. Also, I must add here that the basic issue, if we say we want to roll out a digitized ecosystem and we want that predominantly most of our services should happen there, then we have to obviously, for a country like ours with such a diverse background and so many remote and underdeveloped areas, have to address the basic issue of equity here, which arises out of a large population not having access to internet. So how do we go around that? Do we look for some offline models which could be say uplinked later, sort of mobile model? So those extensions for the last mile connectivity, that challenge would have to be addressed as far as when we look at the operative aspect of a digitized ecosystem. Also, the implementation would have a lot of compatibility issues, which obviously NHA anticipated and is working upon, as in that all the we shouldn't have to build the whole thing from scratch. We should be able to make use of whatever we have existing in existing form. So, for instance, what Mr. Salim has with Omni Hospitals and with Mr. Bhaskar has with the Baptist Hospital, the HMIS must be completely compatible with it. So we shouldn't have to ask them, no, please redevelop your HMIS because it should be ABDM compliant. So it has to be a top down approach in order to build to bridge that gap and ensure that everybody adapts onto it. So it should be a simple, not simple, but it should be a plug and play system, if what I mean. So that's easier said than done when if you're designing something so huge as a digitized ecosystem for 1 billion people. But yeah, so these are the broad issues. But most importantly, what I remarked earlier is the issue of if I want a digitized ecosystem to be the predominant, route here, then I must ensure, and again, as a public servant, let's say the sort of services through that digitized ecosystem, which a tribal villager in a remote mountainous hilly area on the LOC is accessing. So what that tribal villager is getting the same sort of services. I mean, this a techie who is sitting in Bangalore and earning well. I mean, they both should have the same level of access. So that's the biggest challenge in my opinion. That's all from my side. Thank you.
Thank you, Mr. Yasin. So we know that in a country like India, where it's a huge, in terms of democracy, we are the largest democracy in the world. But at the same time, we have different cultures, different geographies to cover. The kind of connectivity that we have across these countries also is vastly different. It definitely will be a very challenging task for NHA to implement it. But I think somebody has to take a step at one point of time. I think it's going to be the leap that India is going to witness in years to come with the support of officers like you. So we'll come back to you for a few certain specific questions. So if I'm asked there will be a lot of participants or delegates who are attending this panel. If you have any queries, please do post in the chat box, so that if you want to ask anything specific to the panelists, please do post in the chat box so that we can answer those questions towards the end of the panel. So now I go to Mr. Arvind. Mr. Arvind, now we have heard Mr. Yasin saying, there are certain apprehensions for the government also to implement the digital health as envisioned by the government of India and the NHA also. So what do you think with the recent focus on digital health given by the government of India? Do you really think private healthcare has already taken some step towards the digital healthcare ecosystem? But do you think this added focus in the budget by government of India and the steps taken by the country, will that strengthen the digital health ecosystem, digital healthcare ecosystem? What is your perspective on that?
Definitely, it will strengthen the digital ecosystem. But first, reacting to a comment from Sri Yasin, the first thing I would say, whether we look at it as a corporate lobby or an insurance lobby or anything at that point, Uh, I think, and also, even if we have to look at it as what will the government do, I think first all of us need to understand that implementing all of this is an act of responsibility that all of us hold. Asking the other person, what are you planning to do, is great. Uh, but I think we need to come together and bring that in. That means that rather than looking at compatibility of systems, each one of us also needs to look at it in terms of how can we put our best foot forward. While indeed, as a joint ecosystem, all of us will be working towards certain governance, certain laws that govern all these practices. But I think the first onus on both public and private put together is it's an act of responsibility and an act of healthcare capacity building for our nation and our economy. So, given that view of it, of healthcare being provided to all, whether it is primary healthcare or complicated tertiary and quaternary healthcare. And when I say tertiary and quaternary healthcare, for which there are wonderful path-breaking thoughts that come out of the Ayushman Bharat initiative as to how they will do that for every citizen and every economic sect of a citizen. But if you look at all of this, the ability to provide that service, in addition to the physical infrastructure and the physical people, is going to be equally or more from the digital sector. And unless the digital sector is going to start being a little more mature, consistent, and trustworthy, thanks to the pandemic, I'm sorry I'm saying thanks to the pandemic, but digital health has become a trusted entity in healthcare delivery. Digital health existed before the pandemic, but it was barely a single percentage or less than a single percentage. It was more seen as an innovation, not as a mainstream delivery. But now we all understand that it is part of a mainstream delivery and is capable of consistency and quality. So, maximizing that, and with the thrust that the budget has given on the Ayushman Bharat initiative and the NHA initiatives, and the thrust that the government is giving also through the budget and through the various other schemes in terms of privacy and security of citizens as they move towards such like non-physical channels of healthcare delivery, I think is a very big boost to digital healthcare. I think what all of us need to do and bring in the technology sector into this and the allied service sector into this is how can we do all of this, keep quality and cost at the scales of India. And here I would not like to distinguish between a tribal in a village versus a techie in a Bangalore. All of us are citizens and all of us need access to the same quality and consistency and surety of healthcare. You don't need to be somebody to receive healthcare. And I think that is something that is definitely possible with all these activities of the National Health Authority, what private healthcare is doing, what each one of us are doing with digital healthcare. But I think we need to bring that together with some sort of a focused delivery, which I think today is happening more on a best case basis and a leap of faith basis, as opposed to happening as a fundamental movement. I think that aspect of the thrust to digital is missing, but whatever is being done, there's no doubt that it's bringing digital to the center stage. The pandemic has added to the fact of it being trustworthy and believed by a majority section of consumers, irrespective of economic class. All that I think is positive, but I would still push for it being an act of responsibility and not private pointing a finger at public and public pointing a finger at private. We can do that. I'm sure those conversations are fantastic to have. But let's get to the basics that we really need to come together to have this executed.
Thank you so much. Thank you so much. Very valid point. So we have seen that recently, right? When the vaccination came in, when COVID as a portal, when government came with that, there was a real mix of private and public in terms of, data sharing, in terms of, implement it across India through a digital platform. It made it so simple, The vaccination in such a big country was made to this extent is only due to the intervention of a digital health initiative in the name of COVID, the portal or the app, whatever we say. It has opened doors. Like any place, you can give a vaccination, update the data, live data there itself. And I think the government has been more open in sharing the data also to the private health players, is what I feel, basically because of the certificate verification or data authentication that the private players also used to do is linked on the Aadhaar or any other ID card of the general public. So I think government is also slowly opening up the frontiers in data sharing with the private players. I think that's a very, very open stand taken by the government, especially in terms of vaccination. I think something similar to this. You can see the power that has brought into the system now. And we were able to achieve the massive vaccination, the targets that we had set for the country. So very interesting perspectives. Both of you have given different perspectives. It makes it very interesting. So now we know that the public as well as the private. When I say public and private in terms of implementation, it requires a unified approach. But obviously, there are a lot of deterrents in implementation of a digital healthcare ecosystem, either in public or private. So I would like to get some input from Mr. Dwivedi. What do you think are the main deterrents that are blocking the progress of a digital healthcare ecosystem, not only in our country, probably across the world? What do you think?
Thank you. So this subject is very, very dear to me. First 5 years, I have really struggled to get any meaningful adoption. So I can share my own experience. It was very poor, as Arvind said, less than single-digit percentage. And after 5 years of introspection and looking into it, I worked on the most difficult area, that was our medical oncology, chemotherapy section. And to anyone's amazement, adoption level rose up to 95+% within 7 to 8 months of the rolling out of the system. So I can tell you from my own experience what really these deterrents are. And again, coming back to that model, at the cost of repetition, very first, poor infrastructure. So when doctor is trying to type something or see a patient's record, and then application is hanging round and round and round, and doctor is waiting patiently, doctors are not patient, they are impatient that way, because there is too much of workload. So very first thing, the desktop is slow, not allowing to work. Network is poor. Application is not designed properly. Doctor wants to see a patient's history, a record, and it is very fragmented. It is not available at one place. So doctor has to go to several screens to find a meaningful information. Difficult to get. Now the patience is already lost. Then you are asking a doctor to type the notes there. The moment doctor starts typing, the eye contact with the patient is lost, and doctor is feeling irritated. Okay. Everything is so easily available, nicely organized in the paper file. Doctor exactly knows where to look. And there are forms there where the lab radiology orders just tick, tick, tick and give it. Now you are asking the doctor to open the EMR application, go to the order form, select a particular test and click it and then save it. This is all causing some, time. I'm sorry, I don't appear to be looking like an IT professional. I look like doctor's proponent, but these are their genuine problems, right? Then you move little further. Doctor is walking on the round, and you expect a doctor to log into the computer in the ward and then put notes there. This is not reasonable. This is not practical. It doesn't work that way, right? And then again, after going through all this pain, doctor is saying, what is in it for me? When I need to publish a research paper, the information is not available in a tabular form. It is not, I cannot get what I need to know. So these are very practical issues. And we understand that, these issues are causing this love-hate relationship that has existed. I mean, I will be a little more bold. A doctor might see in the back of his mind, patient comes hearing my name. I write the prescription, I perform the surgery. What the hell this fellow has to do to tell me that I should conduct my business his way? So, this is the bottom line. We need to understand that technology is
I
am
think
I
we have, yeah. Yeah, I think we lost you in between. You were just talking about a broader perspective. Yeah, you can please continue from there. Yeah.
Yeah, so if we offer them something in return, they will be happy to use the system. So basically, the system that we develop should not be developed in silos. It should have practice specific. So there is medical oncology, particularly lung cancer. Only lung cancer specific diagnosis should be there. That will be 3, 4, 5 line items doctor can click and select, and diagnosis is entered, rather than having to select from hundreds of the ICD codes. Then next is very easy to prescribe. So in chemotherapy, what we did, we exactly knew how many protocols this particular doctor orders, and we created everything related to that protocol. Only thing that was missing was the dose, and dose is auto calculated. So the moment doctor enters the weight of the patient, for non pediatric, height is already fixed. So just enter the weight, click the button, and even dose, etc., everything will be calculated, and everything is now it is in front of the doctor. This is saving, quite a few number of minutes of the doctor, and he will be very happy to use it. Then there is a follow through workflow. So the moment online prescription has reached the ward, nurse knows how to start the treatment, and that waiting time for the file is reduced. So we need to look through entire chain of command and see what is in there for each actor, reduce their time, improve the efficiency, but work on the basics. Then go for devices like mHealth. Let the doctor be enabled to enter the note while on the round. Maybe some voice recognition, maybe some handwriting recognition. Quite a few things I have been practicing with mixed level of success. I don't claim to be at the top of this implementation. We are still working, we are still struggling, and a lot of healthcare ecosystem startups are working with us. More important is having a solid business continuity plan. If we don't have, there is a problem. So fortunately, I prepared the plan and I sent it to Arvind. So we are working together in this ecosystem. Arvind very generously, graciously reviewed everything and he gave his feedback. Now we are working as a kind of platform where we all get together and try to give benefit of each other's experience to this community. When
Thank
that
you.
is, the file
Yeah.
is
So
available, it is waiting for the
yeah,
doctor.
so
The doctor will
that
be
that
comfortable.
that's good to hear that a lot of collaborations are happening, between hospitals in getting some digital tools in place and the implementation level. Yeah, you were mentioning about the doctor's acceptance or compliance to the digital health tools, but at the same time there is a human element also, right, which is missing most of the time. It acts as a deterrent. Basically, when the patient comes in, he wants the doctor to spend more time with him rather than the computer, the human touch. That cultural, the way we have been treated is slowly changing. So the people also have to get adjusted to this new culture, which is again proving as a deterrent. We'll come back to you, Mr. Dwivedi. I think very good points you were mentioning. So regarding the collaborations between hospitals, we will come back to you again. Thank you so much. So when we talk about the different things, I think Mr. Salim, when he made his opening remarks, he mentioned that a lot of things they are trying to implement in Omni Hospitals. There are a lot of things, multifacets to the digital health. When we say the M-Health, mobile health, or the telehealth, or when we say artificial intelligence, remote monitoring, biosensors, there are a lot of things, data analytics, data mining, machine learning, you name it. Now things have come to that kind of a level. Even blockchain is also something which is coming up in a big way. So now, Mr. Salim, on a practical perspective, do you think which all combinations really work well to give the benefit to the patient in terms of comfort, convenience, or for example, safety, or any probably affordability also, or probably reducing the cost to a greater extent? So, what do you think? Which all combinations of these digital tools will be more effective as per your practical experience?
Thanks, Anand. I think before I answer the question, I think Mr. Dwivedi has already highlighted all the problems. And here, if you're talking about the ecosystem, the problem is the non-clinical area, the ecosystem is working end-to-end within the organization, beyond the organization. Beyond the organization, it means your corporate integration with corporate, integration with insurance is working perfectly well, and realization is happening much faster than earlier what was happening. Now, if you're talking about the ecosystem for the clinical data consolidation perspective, so the mention, whatever the component we have mentioned is very, very important. And if any product which has been made beyond and avoiding these component like IoT kind of component, it will not be adopted. It will not be get the success of ecosystem. First layer, as the first layer, at the own organization, are sharing the data with the other organization, are consuming the data with the other organization. So the nowadays there is no choice that the doctors, HCPs have a choice that they will not adopt the technology, because the patient are insisting to the doctors and to adopt the technology. So IoT is one of the component. IoT, if we're talking about AI, ML, speech recognition, your predictive analytics, all this comes into that. So if any product which is not enabling to the end users to achieve three goals, which I always talk about, and you can keep talking about all lot of big product owners, that three goals is very, very important. If the product is not have achieved the three goals, then the adopting and being in the digital ecosystem will be much easier for the organizations, for the fraternity, and across the organization, whether it is private or public. The three goals are: the solution has to be made in such a way that it is faster than paper. If doctor is scribbling in 1 minute, 2 minutes, 3 minutes, the technology should allow it to script that prescription within three minutes. It does not need any training. The doctor does not need any training for it. If say I'm going to come and train, doctor says, what are you going to train me? You are an engineer, you're going to teach me the medicine? No. It does not need it, because doctors understand much better the dictionary, the clinical jargons, and everything much better than anybody else. And then he said it should have the sub-second response where eye-to-eye contact. Mr. Dwivedi has spoken. So all these three goals, if has been put into the design and develop the product, is definitely is going to exaggerate the ecosystem, digital ecosystem for the organization. We are putting the digital technology, too much of technology, but adoption is not up to the mark. As for the single digit, if before pandemic it was in single digit, but maybe I don't know, it has come up bit of over, but there are counted hospitals which are using the clinical system end to end, adoption is beyond the average. Otherwise, the maximum hospital, they have taken the solution, but they could not adopt it due to these three goals were not there into the product. Having said that, here at Omni Group of Hospital, we have ensured that any clinical data, if it has not been consolidated, then it is not a digital ecosystem, whether the data is coming um, from equipment, from HIS, from the clinical system, and if and it is integrated with this drug database, it is integrated with the evidence-based guideline, so that at point of care, the right clinical notifications to the doctors is being given, so that the patient, so that the doctor is giving the right medication, right suggestion, without any committing clinical errors. So this is what we are doing at Omni Group of Hospital.
Thank you,
And,
Mr. Salim. So I get your point. So what you're saying is basically need-based products. The customer need-based products is something which has to be brought to the market, which can really help the doctors as well as the end user in getting it implemented in the best way. Yeah, thank you so much for the perspective. So now we go to Mr. Pradeep. Mr. Pradeep, now digital health has also opened up frontiers, right? In terms of research for many departments, including oncology. So, is there anything that you are using in your institute, any digital tools to enable research, especially focused on specific departments, or any general research also in terms of digital tools?
Yeah, so let me address that in two ways. First, in the space of oncology, we will admit that we have some very impressive numbers at our hospital, but we have very good experts today with us. Mr. Dwivedi would probably have a lot more insights into the specifics of oncology and the research that goes on in that space. From our perspective as a hospital, before I dive into the research part of it and the tools and technologies that we embrace, I'd like to refer to Mr. Yassin's comment about the interoperability of systems and the redesign of systems to be able to embrace this new paradigm where we're shifting towards an ecosystem where looking from high school biology, we can talk about the symbiotic kind of a environment. That's the only thing that makes an ecosystem successful. And that's where I think interoperability plays a large role, where tools and systems need to talk to each other and then transmit the right kind of information to be able to leverage it more effectively and to actually make some strides in discovering what we need to achieve. The center focus being an ecosystem, the most important part that we should actually look at is it's all about the health that we need to deliver to a patient. So the center stage should be occupied by health, positive health outcomes, and the patient experience, and that should be the center stage. The digitalization and the technology is more in terms of an assistive uh, tool to be able to achieve that. We very often forget what we when we talk about digitalization, we say, okay, it's easy, we can capture data, we can analyze it, we can do a lot of things with it, and that's all exciting. But then we've already discussed challenges in this space where it comes down to a burden on people, a burden on the effectiveness of what job profile was, and then the transformation of that. Say, for example, Mr. Dwivedi referred to doctors, and Mr. Salim also said, if it's interfering with their work, it's not achieving what it's supposed to. So we need to be sensitive to that, and then we need to calibrate and sensitize the amount of digitization that we impose on different functions. Now, coming to research in oncology specifically, and other initiatives in other departments, I think the philosophy needs to be designed towards research in the space of the disease itself. So the biology of the disease should drive the research in technology, in the digital technologies. Say, for example, if AI is focused on the wrong space and trying to find patterns in something else, it doesn't really contribute to the actual focus area of what disease we're trying to cure or what disease we're trying to get more insights into. So the statistical analysis that an AI algorithm does with, we have enough data. I think we're already collecting a large volume of data. I mean, I'm specifically saying in terms of a global access to, cancer research databases, we'll find a lot that we can actually process and discover information. So there's enough resources to work with. But when we need to point it to a specific area, we know that the disease in terms of, if we were to look at, I'm not a cancer expert, but if you look at where the clinical conclusions are with respect to detecting the disease and then actually also diagnosing it and then actually treating it, there are major strides that are taking place. One of the concepts is, now we know that it's 15% of all cancer is related to viruses, and these are the typical viruses that we find. Now, what is impressive is, and where we are approaching in terms of healthcare is, we have the traditional diseases well under control, but we are coming to a point where progress is going to be only possible if we look at the application of technology in a biological paradigm. And when that's where genetics comes into the picture, and then viruses and virus DNA comes into the picture. A very recent example would be all the mRNA vaccines that we have with COVID. That's a frontier of research that we're headed towards in the clinical space, and cancer is no different. Um, uh, we know if it is, caused by genetic changes at the cellular level. What is very fascinating to me is that that's not very different from, programmer programming, a software to be able to achieve that. In fact, some of the tools that we use is, with CRISPR and other things, is to splice software code onto the DNA of the cell to be able to cure it. So those are the kind of technology research frontiers that are something that is coming together. But I
Thank
would
you.
say,
Thank you, Mr.
in a
Pradeep. I think
yeah,
that's such an interesting perspective. Actually, using the digital tools to predict. That's what you're saying, the predictive learning, right? So,
yes, yes,
in terms of application, so I think we are almost coming to the end of the panel. So I'll go from you to the other panelists. Just tell me a percentage. There is no need of an explanation because we have to take some questions from the participants too. So, what do you think will be the percentage of adoption of digital healthcare in our country in next 10 years? Mr. Pradeep, I'll start with you. Just give me a percentage that you think.
I think when we look at maybe electronic health records, I think we'll approach maybe 90 to 100% very soon. I think many hospitals are doing it. It's not there yet, but
90
I
to
think we will be
100.
able to do that.
Very, very optimistic. Thank you. I'll go to
Yeah.
the next person. Mr. Salim, what do you think? What will be the percentage in next 10 years digital health adoption? Mr. Salim?
I think there is no choice either from the HCPs and the healthcare organization and healthcare providers that it should be 80 plus,
80
80 plus,
plus.
80 to 85
Thank you.
percent definitely be there.
80 plus again, very optimistic. Okay. Mr. Dwivedi, what do you think? What could be the percentage?
So whatever we have seen in last 1 year has not been seen in past 30 years. So going by that trend, I think we are in very good shape and we have no choice, as Salim said. It has to come on board.
So you also go for an 80% implementation next 10 years.
I mean, difficult to put a number, but yes, very high percentage of adoption.
Okay. Okay, so we'll go to Mr. Arvind. Mr. Arvind, what do you say?
I'll be delighted if we touch 50%.
So you are the most pessimistic person in the group. Let's see. Let's hear from Mr. Yasin and then we'll decide.
Yeah, so I just want to go back on the one point that we went back and forth upon. So I look forward to the day when Apollo Hospitals will open a hospital for the tribals of J&K in the LOC. And but till that time, I invite you, Mr. Siva Ramakrishnan, or all of you, in fact, to JMK and work with us in finding digital solutions to the access issue here. But in response to your question particularly, if I have to answer as the SNO of ABDM, and if we are saying that everybody should be using the ABHA IDs as hospital transactions, I'll say it will take us to achieve 10%. It will achieve 5% in the coming year. Next 1 year, we'll be achieving 5%, and possibly 80% in the next 5 years. That's my very honest
Oh,
assessment, and by that I mean health transactions at all levels: primary, secondary, and tertiary. That's all. Thank you.
that's great. That's great. So, one last question to you, because you are the only persons representing the public health. Do you think there can be, when NHA implements this, will there be any statutory controls that government is also planning to bring in the digital health scenario? Any broad level you can just mention?
Yeah, so I am not a part of the NHA core team, but because I'm taking care of ABDM implementation here, yes, regulatory controls will be there. I mean, for instance, in the HPR and HFR registries, we are using the Medical Commission of India and the State Medical Council registrations as the basis to work upon. And also, so frankly, as of now, we are completely dependent on what the NHA is rolling out. If at all, we have to look for comprehensive or customized or localized regulatory frameworks, then that I believe would evolve with time. So that's why we have to balance it out. There would be a centralized a mechanical top-down approach, and a more organic bottom-up approach will be coming in the form of innovations from the states. That's how I see we all achieving this goal together.
Thank you, thank you. So just to give you since I also represent private health, I just want to make a last remarks. Aster, I represent Aster. So we have actually set up our medical college hospital in a rural area, which is one of the most distressed district in the country, which is Wayanad. So private health is also entering into areas where we are really partnering with the public health in
Certainly, and we look
addressing
forward to
the
that.
basic needs. Yeah, we are all there. I'm sure Mr. Arvind also will agree to that. We will definitely look at opportunities where we definitely get to serve the sea. Ultimately, the primary aim is to serve the public, right? Ultimately the profits or whatever we say, the corporatization all comes next. Somebody actually mentioned, I think Mr. Pradeep mentioned positive health outcome. Is that what he mentioned? That what matters the most. We are here for that. Our purpose is that actually. Yeah, obviously down the lane,
Indeed.
many people have gone into commercialization. But yes, of course, we will come back and
Indeed.
go to
At the end
the.
of the day, we are all in this together. We have a common
Thank
goal.
you, thank you. Thank you. So we have come to the end of the discussion. So let me ask somebody from ELETS if there are any questions from any of the participants. Because I can't see any questions here. But this, I think, is a private login section. So somebody from ELETS can respond, please.
Uh, I'll just have a look if they have any questions. Can the backend team please check if there are any questions around? Yes, sir. We have questions here. This is a question for Yasin, sir. What are the key initiatives lined up for the health sector in coming times for J&K?
Oh yeah, so a whole lot of them actually. So obviously we are going big with the ABDM. We want ourselves to be the leading UT, at least taking ahead the charge. But we're also looking at smaller applications for subsectors within health, to which will be then plugging into the ABDM framework. So for instance, we are the first state which is going for digitizing the RBSK, Rashtriya Bal Swasthya Karyakram records. We are generating an app which RBSK teams will be using to log the data collected in the screenings of children, and that would add to their UHID. So that's one of the first things we're doing. We've also done smaller things like chatbot extensions for feedback collection, 104 helpline. We've also created a dialysis scheduling alarm app for our public hospital dialysis patients. We've also created apps for our own in-house service managements, like issues like, say, Asha is not getting incentives on time, and we've linked it to PFMS. We call it the Asha Gulak app. So the perennial issue of public systems not handing out salaries to ground health staff, we've resolved all those thanks to technologies, and many other things in the fray. But as I said, these are smaller decentralized innovations from our end, which we are confident will be able to plug into the interoperable platform of ABDA.
There is one more question for Yasin sir, in fact, again. Do you think that PPP is the way forward for improving healthcare infrastructure? Any
Certainly,
collaborations the government
certainly.
has in
I'll tell
pipeline?
you why I would possibly be the most unsuitable MD NHM to be on this panel, because JNK is a state where out of the total number of hospitals, we only have like 5% hospitals in the private sector here. Because I also am CUSHA, so I mean, I can tell you the data. Bulk of our tertiary care load, primary and secondary, is obviously there. Bulk of our tertiary care load is taken care of by private hospital, by government hospitals, and obviously there have been political and law and order issues why we haven't been able to invite private investment there. Here. So yeah, but that is changing now with post Article 317, whatever massive changes we've had. JNK is open for investments, and we are already working on very massive private-public collaborations. I'm sure you would have heard of the two medicities that are coming up there, and we're actively seeking investments in the health sector from private companies.
I think that brings us to the end of this panel discussion. It was wonderful hearing all the panelists here, and we heard so many new things, and it was very insightful. And thank you, Devanand sir, for wonderfully moderating the session and getting so much information out of all our panelists. And now we have some certificates, thank you certificates for all our panelists here. The first one is for Mr. Yasin M. Chaudhary.
Thank you so much, Ms. Manjul.
One for Mr. Devanand Keti, and he's been a wonderful moderator today.
Thank you.
One for Mr. Arvind Shiva Ramakrishnan. One for Mr. JP Divedi.
Right.
And a certificate for Mr. Abdullah Salim.
Thank you.
And a certificate for Mr. Pradeep Bhaskaran. I think all of us can, give a round of applause for all the panelists here, in fact.
Taranum, just I'll take one second to
Sure, sir.
just
Sure, sir.
thank all the panelists for the very detailed conversations that we had today. I look forward, to meeting you all and interact with you in person and at different forums later on. Thank you so much. Wonderful chatting with all of you. Thank you.
Thank you so
Thank
much.
you so much, everyone.
Thank you all.
Thank you very much. Bye-bye.
Have a great day, sir.